our first online patient webinar. This is specifically on how to use IT for health. My name is Adina. I have with me
Joel
and Hoimi. So all three of us will go through a few topics that will be of interest for people who want to use IT or the internet for their health. Next slide. So these are our designation. We are from the Department of Primary Care Medicine, from the clinic that's widely known by RUCA. So we are the lecturers or the doctors that work in RUCA. We are going to cover things on use of IT for health, online health information, to trust or not to trust. And lastly, we will touch upon our new appointment-based clinic system that we have in RUCA or UMNC currently. Okay, just to start, I would like everyone to choose one symbol from the panel of symbols that you can see. Choose one, anyone, but just one. Okay, next. Can you find the symbol that you chose on the circle now? Okay, Amiro, what symbol did you choose?
I choose love symbol.
Okay, do you find it?
Yes, very easily find it.
Okay.
On the fourth row.
On the fourth row. Okay. And Hoimin, what did you choose?
Choose the apple. I couldn't find it.
You haven't found it yet?
Yeah.
Okay. Maybe Amiro can help, or maybe I can help. It's at the bottom there and above the cake and next to the champagne bottle. In the middle. Next to the whisk.
Yeah.
Yes.
So yeah. So why are you having this game? Okay, what I want to illustrate from this game is that a lot of people have information that they want to look for. Sometimes I also choose apple, like Hoimin. So some people have the same needs for information, and Amiro have a different needs. And some people can look for the information quite easily, but some may need help. So whenever you want to start this journey into looking for information or use the internet for health, it's important to know that you are not alone. There's a lot of people that wants to know the same type of information too. Okay, next. So this is what we're going to talk about today. We hope to have a segment for question and answer, and we welcome all your questions. Either post it here on the Zoom chat or on the YouTube comment. We will try our hardest to address your questions or any concerns that you may have. Next slide. Okay, again, it's very important to say that different people have different level of skills, especially when it comes to internet, and it is okay. Okay, no problem with that. We are here to show you some of the tips and tricks, but you also can ask help from your more internet savvy family members, friends, colleagues, or even your doctors. Okay, just a short history of the internet. The internet has been around for a long time, since the 1960s. Okay, so those that are born in 1960 cannot say they don't know internet as well, because it was born during your time. And just to say that it started off from actually a military program where they wanted to distribute the information that they know to a different areas, but these different areas are interconnected. And if one day people just, there's a war and there is damage to the central place where they keep information, all the other domains are still intact, all the other places are still intact, so the information is preserved. So that was the idea of the internet since the 1960s, but not until 1980s will the type of internet that we know now are born in 1st of January 1983. So it was born all the way back in 1983. But since then, the internet has grown and become a major part of our life with the discovery of the email. Okay, so now we rarely write any handwritten mail. We just write an email to ask our friends how they're doing and give information or ask for appointment and things like that. We also in the 2000s saw the booming of social media. Social media is where you can connect with many people through a program, such as the most famous one probably is Facebook. But now we also have Twitter, we have Instagram, we have TikTok, we have Snapchat, and many other different programs. All these are considered as social media because the program can connect you with many thousands, millions of people. And then, so that's the short history of the internet. So just to say what are the terms that we need to be familiar with when we try to navigate the internet. So number one, okay, these are the common terms that we have here. Number one is the URL. Okay, number two is the browser. Number three, social media, which we already touched upon. Number four is spam. Number five, search bar. Number six, domain. Number seven, scroll and hyperlink. So just to go through a few of these, I think some of it is already well known by people, but just so that we are talking about the similar things. So URL stands for, wait, let me refer to my notes. Uniform Resource Locators, okay? Uniform Resource Locators. They are basically web browser address, okay? So they are like your house address when if you have a physical house. So URL is like a house address. So you need to know like where you want to go on the internet by using the URL. So certain places that offer services or information has their own unique URL. Okay, so that's how you should think about URL. It's just an address. And like address, you have the number of the house, you have the jalan or the road, and you have the kampung. So URL is something like that as well. All the different segments of where they belong to in the internet are captured in the URL. Okay, what about browser? Browser, I think you all know. Okay, browsers are just like a door, a window into the internet. So you need a door to get into the internet, and the door is through a browser. Again, it's also a program, a software, where people can then type their URL, then the program will bring you to the address that you want to go. Okay, so that's an easy way of thinking about your browser. So the more famous browsers are Chrome, Google, Microsoft, Explorer, but the new one is Safari. So they are Edge, Microsoft Edge, yeah. So those are the browsers. Social media we talk about, and spam. Okay, spam. What is spam? Is spam similar to hacking? Okay, spam are just rubbish, or what do you call that? Unwanted, unsolicited. Either mostly emails, okay, because sometimes we share our email address to with many people. So then the people can use your email address to send you spam. So spam are unwanted, unsolicited email. What we can do is that you can put in filter to filter out spam. So because you have to be very careful, some of the spam email are phishing email, meaning they will try to get more information to access more sensitive information from you. Okay, next is search bar. Search bar, the most famous search bar is of course Google. Okay, Google's modus operandi is just one search bar and whatever drawing or icon that they want to show you. Okay, but it is important to have a search bar, because this is true. You can look for other addresses that you're not aware of. Okay, let's say you don't have an address to UMMC. So you cannot type in the URL if you don't have the address, right? But using a search bar, you can just put UMMC there, and then they will bring up the link to, or the address that you can go to get into the UMMC website. Okay. Next is domain. Domain is very important. I will just stop there after the domain. Domain is to show that it's basically which in the URL, which group do this address belong to. So the way to think about that is almost like a state. Okay, so remember during our phone, we have 09 for Terengganu, 03 for Selangor. So those are something like domain, because it will group this phone number together to say that they are from Selangor. Group then this number together, say that they are from Terengganu, and the domain will group the address, the URL together, and tell you with great conviction that these people are from certain organization or institution. So for example, edu.edu is only meant for educational institution. So like universities, okay, colleges, they can only those that can use the .edu domain. .org is usually belong to organization, something that is established. So they have to show proof that they are a well-known organization. They can use .org. And most importantly, .gov can only be the group of URL under .gov only from the government. So if you want anything official, you have to look for the .gov in the URL, the domain name in the URL to say that it's coming from the government. Okay. Next slide. Okay, so what essential skills do we need if we want to use the internet? So there's only 3 that you have to remember: locate, analyze, and use. So by locating, analyzing, and using this information, we then can use the internet to help us manage our health. Dr. Lim Hoi Min will do more, will elaborate more on where you should look for the information and what type of information you can trust. Next. Okay, now just a bit more information about the device that you use to look for this information. So currently, previously, we only use laptop or desktop. Usually we use desktop, then we use laptop. But now more and more of us are accessing internet using our mobile devices, either a phone or tablet. So that is more freer. We can bring it anywhere with us. You can bring it even when you are waiting to see a doctor here in Ruka. So what are the advantages and disadvantages? So you can read here. But I would say that in certain websites are better read on the laptop or desktop because their mobile layout is not so friendly for people to read through. But some websites are quite good. So you just have to see. If you found the website on your mobile device not very good to read, try and look for it on the laptop or the desktop. You might be able to see the information better. So that's my advice here. So how can you get online? Okay, so easy. Okay, if you have a phone, you usually have a network provider. If you have a network provider, they can give you a phone, telephony, or landline connection just by calling people. But usually they also have data. So you can look into your network provider, Maxis, Celcom, DG, TM, okay, U-Mobile, what is the access that you have? If you have data in there, means that you can already surf the internet, okay? But other ways of getting internet is through Wi-Fi routers, which we usually have at home or at work. Usually these Wi-Fi are more stable than data, and they don't run out. But the problem with your data is that your network provider might give you only a little bit per month. Okay, if you really like to surf the internet, you might run out of data. Okay, but I just want to say here as well, in Malaysia, there is such thing as the Pusat Internet Community. Okay, where you can go and have access to internet as well as a desktop there, as you can see at the bottom right-hand corner. So there will be facilities there that you can use to serve the internet. So these are called Pusat Internet Community, and you only have to Google them, use the search bar on Google and look for it in your area, okay? And what can we, if we have access to it for the internet, what can we as patients or as citizens use it for? So I would like to encourage all of you, all of us, to use the internet to look for information, health information, not only health information, but also information about your hospital, about your clinic. Okay, you can learn so much about your clinic or your hospital through the internet. What are the opening hours? What days are they running certain clinic? What days can I come for screening? Do they have extended hours? What type of services do they have? Do they have women's clinic? Do you have child's clinic? So all this information you can get through the internet by just searching for your health facilities. So I put here the website for UMMC. And I would suggest people who come to UMMC for their health care, for clinic appointment, do try and visit the UMMC website and see what information you can find there. Other types of information you can gather is also from wearables or stuff or apps. These two things, what they do is they try and gather information about your health while you are away from the healthcare facilities. So a wearable can tell you how much you walk, what is your heart rate, so then that information can be relayed to your healthcare provider. And apps, okay, can be used to make appointment, can be used to track your food intake if you want to, can be used to track your water intake. So these two types of devices can give you and your healthcare provider more information about your current state of health. So just as a summary, okay, how using the internet for health can be helpful. So these are the points that I want to raise, but also for you to see whether we have covered this in our talk. Number one is to find information, not only quickly, but the right information. You can check your health symptoms online. You can understand about your disease better. You can communicate with your doctor or nurses by visiting the healthcare facility website. You can look for wellness tips. Okay, these are everywhere. You can only have to use your search bar. And also you can use wearables like smartwatch or even your phone, apps on your phone to track your health condition. Next. That's it. Thank you very much. Is there any questions? No? Okay. Let's go.
Hi, good morning. I'm Dr. Lim from the same department of primary care medicine, University of Malaya. So today I would like to kind of share with you all when you encounter an online health information, whether you can trust it or you can't trust it. So there's some of the sharings and to tell you all how you assess the credibility of online health information. So what is your sources of health information? Is it from your pharmacist nearby or the doctors who you visit? Or it is Google, where you usually search in the toolbar, or social medias? I think recently a lot of people just ask the ChatGPT on some of their signs and symptoms. Or you are more rely on the traditional sources such as books, magazines. So all this information is actually important to help us to make a good decisions in terms of managing your health or helping your family members or friends to make the decisions about the health. So we are focusing on online health information because I think from the national survey, we noticed that there are a lot of people actually search information from the internet. So from the 2020 statistics, we have 88.7 people in Malaysia actually using internet. And it has been increasing trend since 2018. Next. So I think just now Prof. Adina mentioned about the differences between different devices. I think the most common one is just smartphone, where almost 99% of people are using smartphone to look for information. So from our study, we did a small survey in our clinic to collect data among patients who are attending our primary care clinic So what type of health information they are searching for? As you can see, 54% of them are looking for for a specific disease or health problems. Some of them look for signs and symptoms that they encounter. A lot of people also looking for medication information, treatment procedure, where to get treatment. And I think 21% actually also looking for other complementary medicine, such as supplements, traditional medicine, etc. So we also ask our patients how much they trust information they found in the internet. So we compare, if you look at this bar, is with different color. The first one is their trust in healthcare professional. So the brown color one is actually completely trust. As you can see, we set it, we use the trust in healthcare providers as a reference point here. So our patients trust healthcare professional quite a lot. If you can see complete trust, and the yellow mostly trust is almost 90%. If you look at the internet, you look at the point at the yellow bar. So if you refer to a specific website, so it is almost 40%. I think the least trust would be from the social media. So as you can see here, why the trust varies according to even within the sources of internet. As you can see, there are certain criteria and people are looking at why they trust information differently. So I'm going to talk a bit more about the information from different sources of internet. Next. So I think since COVID, online information and online misinformation has been a popular topic. And I think when everyone quarantined at home, one of the main information sources from the internet. I think we experienced a lot of information overload from talking about COVID vaccine. So now COVID vaccine coming down, but dengue is coming up. And I think this old topic about the papaya leaf is coming back, whether you should drink papaya leaf when you have dengue. And currently, I think you can see the Facebook post just last 2 weeks ago, they even extending the use of papaya leaf to treat hypertension. Yeah, so next. So I think there are a lot of misinformations. Whether I think the latest hit topic is about 5G is actually causing cancer. Is it true? So when you're encountering so many of these types of information, how can you appraise them, assess them, see whether are they a good information or bad information, and how can you assess their quality? So we also did a study interviewing our patients, how do people feel after reading health information? And you can see whether do you feel the same as our patients. So half of the patients feel very positive when they encounter the information from the internet that is consistent with their doctor's advice. So they feel more reassured, more confidence on the treatment and the medication that they are taking and prescribed by the doctors. Of course, depends on the information that encounter. Majority of patients also feel hesitated whether they should continue taking the medicine, whether they should go for the vaccination. And with the information from the internet, advice from the doctors, from friends and families, if they encounter contradicting information, they get confused. And some of the information kind of exaggerate some of the side effects, so make them worried about the medications that they are taking also. So then come to our main questions. So can I trust the online information? So when we're assessing online information, I think I would just give you 6 points. Maybe there are more, but I think these 6 points would be the important ones to help you to decide whether you can trust this information. So the first one is source. Where is it come from? Second is quality, how good it is. Evidence, is there any evidence to support the claim that written in online information? So up to date, it is current or it has been written 10 years ago. Bias, is there any conflict of interest? And privacy, does it protect your data? So next. So be a skeptic when you read online information. So I'm going to describe or discuss the points one by one. So regarding the sources, I think just now Prof. Adina also mentioned about the domain at the end, where is these resources come from? So one of the guide is you can see whether the website address is by .gov, which is from the government, .edu from the educational institutions, or .org. So these are more reliable informations. So give you a plus point on the information that you encounter. .com, not sure. Some good and some bad. Thanks. So I'm just using this Mayo Clinic information as a guide to show the types of the different criteria that you have to go through. So in this Mayo Clinic, you can see that it's www.mayoclinic.org. So it's from an organization, so it's likely to be more credible. So after you see where the sources from, so next is the quality. So when you look at the quality, it's important to ask yourself who wrote the information, and is anyone reviewed the information that has been written by the author? Does the website have an editorial board? Are the writers experts in the area? So usually where you get it is there's usually maybe a tab or a link about us in the website, which give you all this information. So we go back to example Mayo Clinic. If you look at this, so this is one of the important topic as well currently, the long-term effect of COVID. So if you can see, so there is a link by Mayo Clinic staff. So you click on this. So you can see that they have a list of medical editors with usually are doctors with credible affiliations who are the editors or the editorial board for this information. So this is more likely to be credible. So after you assess who wrote the information, next is the evidence. So is there any evidence that back up the claims or information that written in the website? So what are the references? Are they from reputable institutions or journals? But sometimes also be skeptical about people's testimonials, whether is the testimonial credible or something has been written by the author themselves. So how you look for evidence? Usually it's at the end of the information. So either they've written down all the references or there is a link where you click on the show references. So there's a list of usually are those research or the statements come up from the government institutions telling you that their information is actually from these resources. Next is up to date, whether when was the information written? Is this up to date? So what you can see this is the same information that I show you about the long-term effect of COVID. So usually they will have a date there. So this one is quite recent, June 22, 2023. So some of the information they may not update so regularly. So for those, because we have new evidence coming out in the medical field, and some of the evidence is also keep changing. So some of the medicine which is effective 10 years ago may not be effective right now when there are new evidence or new research coming out. So that's why the currency of the information is also important. Just now we talked about the references, right? What supports information, but do aware of, be skeptic about the information that people written. So this is one of example of poor quality information. They also cited American Journal of Cardiology Drugs. They cited a study from Harvard, which sounds like credible information, but do ask yourself whether is there any bias in terms of the statement. So the evidence is there, but when the author write their own health information, did they put bias, or did they actually rephrase the evidence in the article? So I think my next slide is also you ask yourself whether is there any bias in terms of the information. So how to look for the bias is you can look around the website. Who is funding the website? Is there any profit linked to the website? And what is the purpose? Okay, so this is one of the example where they talk about heart attack in men versus women who is at greater risk. So at the end, you can see that there's a company sponsored this website. So I'm not saying that those drug companies sponsored or company sponsored information are bad. Some are actually provided very good information as one of their community responsibility to the society as well. But some may not be of good quality and some may be biased. So do ask yourself, what is the main purpose? Are they trying to sell you something or they are trying to educate the public? So last but not least is privacy. So is your privacy protected? Are they sharing any of your personal information? Are they asking for any personal information, for example, names or email address, phone numbers? So does the website clearly state a privacy policy? So if you can see, go back to our next. So we share information with companies that can provide you with products, right? So sometimes be skeptical and look for the privacy statement next. So this is one of the examples from the Mayo Clinic that they actually usually have a privacy policy, and you have to read into the policy to see what is their privacy policy. Next. So be a skeptic. Ask yourself, does the website offer quick and easier solutions for problems? Are miracles cure promised? Or does it sound too good to be true? So website that's linked to a trustworthy source does not mean it has the organization's endorsement. And also sometimes good information usually give you a balanced view. They talk about something good about this treatment, but they also will tell you something, some of the side effects or possible risks about the treatment. So if you can see some of the information is too biased towards certain treatment, so ask yourself, is there any bias or is it sound too good to be true or too bad regarding one of the treatment that the information stated. So when after you go through all the 6 criteria, some of you might not be able to assess the quality of information well. So sometimes I do face the same problem as well. I think currently the authors, some provide bad information, but they do trick around the content and make it very real. So one of the recommendations that I would give is to discuss online information with your doctor. So we also survey among our patients. Have you ever discussed online information with your doctor? So we can see that almost 48, half of them will seldom or never discuss information from their doctor. And when we ask them why you did not do so, and patients usually would say, I think I'm trying to ask, my information is about traditional medicine or supplement, which may not be relevant to these consultations. I'm scared that doctor might not be interested on the online information. I don't want to disturb the doctor, they are busy. So next question, but I would encourage you to talk to your doctor. So inform your doctor what you have found. And if you can, just bring along the health information. You can save the link in the WhatsApp, or you can save the link somewhere else that you can show the doctor immediately, or you're afraid that you might not have internet connection during the clinic consultation, you can just print out the online information and show your doctor. So when you show your doctor, ask the doctor, is there any research to support the health claims? So is there any side effects about the products you wish to try, or the information that you have found? So is there any other better options, or what are the available options for you for your health condition? So tell the doctor what is important to you. So the take-home message is it's important to assess health information because your decisions may change your health. And think of all the 6 criteria when you assess the information and talk to your doctor. And sometimes what I keep stressing, talk to your doctor. Because if you look for an information talking about certain supplements, and when you keep assessing, when you keep searching in the internet regarding the similar information, you might keep encounter the similar information that make you think that the information is actually true. So, but actually is a misinformation or is a bad information. So you need someone to kind of give you a different perspective, to rethink whether the information you encounter is true or bad. So do talk to your doctor. So welcome any questions?
Okay, thank you very much, Tahimin. I think that is very important. We don't usually want a lot more work, but in this case, we really would like to encourage you to talk to us so that we can both learn about the information that you found and how can we use that information to help you manage your health. Okay, so we are here, we are ready to help. So no one is more ready to help than Amirul. So Amirul is gonna go on and teach us or tell us about how to use this new system in Ruka called ABC. Over to you, Amirul.
Thank you, Prof. Adina. Okay, so today I'm going to just introduce our new system, which we call as ABC, which is a short form for appointment-based clinic. So Ruka appointment-based clinic, or we call it ABC, is a system that allows the patient who wants to visit the clinic to book appointment in advance remotely via the usage of an application and also a website. The reason why we have this appointment-based clinic is previously we encountered a problem where patients come as early as 6 in the morning and start to queue up, but in the end, because of the limited quota, because of the changes in workload of the workforce in the clinic, some of the patients might not be able to even see doctor even after they have queued up for several hours. So because of this, we want to have a system where everyone can actually check the available slots of the appointment and book their slots and come at the exact preferred time. So they don't have to wait for a long period of time and they can ensure a successful visits to the clinic. And true enough, after the implementation of this system, it shows not only that this system reduced the waiting time, but also it doesn't change the number of visitation to our clinic. And as for doctors, it will give more time for the consultation between the doctors and the patient, and this will ensure an optimized care to the patient. Okay, so let's look how the flow of this appointment-based clinic systems. If you can see, it started with an intention from the patient who wants to visit Ruka. Let's look at the left arm of the flow chart first. The patient have to make an appointment via application or website, which I will show later. And on the website and or the application, the patient can select preferred date and time. And after they have managed to book an appointment, they just need to present to our clinic 30 minutes before the time, and they can see the doctor. However, we does not discriminate and we does not prevent patient from coming to see us even without appointment. If let's say there is an urgent case, but the patient are unable to make appointment using the system, and the patient presented to our Ruka triage counter, or we call it pre-queue, there will be a staff healthcare workers that will triage the case. And if let's say we need to allow the patient in, even without the appointment, we can allow the patient in via our buffer system, and eventually patient will we are able to see the patient as well. Okay, now let's see how we can book the appointment. As I've mentioned, we have 2 ways of booking the appointment. For patients or public who are using Android phone, they can go to the Google Play and they scan this QR code and download an application called WeHealth. However, for those who are using laptops, computers, or Apple products, they can go to the website that is called www.umchtech.com, where the interface is quite similar. I will show you 2 videos on how to make an appointment. Let's see this video together. So as you can see, the appointment system does not only allows you to book an appointment, but also cancel your appointment should you choose not to come for your appointment. But this is for Google Play Store Android application. But if let's say you have Apple using Apple products, you can use the website which we will show in the next video how to use the next. Okay, yes. So you just open your browsers and you will see this like so that is how you can make an appointment using both the application for Android phones and also using the website for those who wants to use laptops and also Apple products. So next slide, please. So we shall go on some frequently asked questions regarding our ABC system. For example, if you are having some symptoms suggestive of COVID-19, can you book an appointment for ABC using ABC? The answer is no. The system is intended for stable and non-PUI cases only. Patients who present to RUCA with symptoms suggestive of COVID-19 will still be triaged, and bypassing the system, you don't have to make an appointment. You will be seen in our respiratory room. If you are having an emergency situation, do you book an appointment using ABC? No, again, the system is intended for stable cases only. If you have any emergency condition, you should present yourself to the nearest emergency department. You are living far away from UMMC and you have difficulty to come. That is the beauty of the system, because this system allows you to make the appointment remotely. You can make appointment even when you are in Seremban or even when you are somewhere far away. And if there is an available slot for today, you can book it on the spot, even if you are in front of our triage counter. So if you want to come earlier than appointment time, is it allowed? No, you are not allowed. You are only allowed to come in only 30 minutes before your appointment time, because you want to make sure there is no overcrowding in the clinic waiting area. I arrived later than my appointment time, according to our websites and also the appointment disclaimers. Your appointment will be automatically cancelled should you arrive later than your appointment time. You can book another slot if there is available slot for the day. If not, you need to book another slot for the next day. However, if let's say you have semi-urgent situation, our staff nurse, our healthcare workers will still triage you and may allow you into our buffer system. I'm facing technical difficulties while booking the appointment. You can email at support@umchtech.com or you can WhatsApp at 018-2181-328. However, this is for technical support only, not for resolution of your symptoms. Right, so next slide. So this is how you can download the WeHealth apps, or you can see the videos once again. You can just scan the QR code there and go to the videos. Okay. And these are our triage counters and our pre-queue counters that is always manned by our staff that is always happy to help should you need any assistance or should you still want to see the doctor despite not having appointment. A lot of misunderstanding happened with our patient that they thought with the appointments based systems, they are not allowed to come in when they even don't know how to use smartphone. That is not true. We don't marginalize those who cannot use internet, those who are not IT savvy, but we will for sure help them. What we will do is we will help them to use if they have smartphone. If no, and they still need to see the doctor on the same day, we will actually bypass the system and go into our buffer system, which in the end, they will still be able to see the doctor. And I believe we have one question just now.
Thank you so much.
So can we highlight the question or just I read it from here lah? Okay. All right. So the question is, can you register under your name and make appointment for someone else? For example, to make the appointment on behalf of my mom. Okay. The first part of the question, can you register under your name and make appointment for someone else? That is actually not allowed. You need to register one account using one email address. So if let's say you want to register for your mom, you need to create an email address for your mom and register using her email address. By using her email address, you can make appointment under your mom's account. And a lot of our patients have their son or daughters help them via this way. What they do is they create an email account for their moms or their parents, and they make register under UMCH tag or WeHealth application using that email address. And in the end, they make appointment using that email address. The reason we don't want you to use your account is because later when you come to a hospital and you need to book your own appointment, there will be a confusion there.
That's also the next question is also on
Yes.
ABC. It's about, can you make an appointment for the same day?
Can make appointment? Yes. As of now, we open the slots for 48 working hours prior the actual dates. For example, if today is Tuesday, we have already opened the slots for tomorrow, and also on, I'm sorry, on Thursday it is on her leave. So we are already open for Friday as well. So 48 working hours. So yes, if let's say you come tomorrow and the slot is still available, you can make appointment for tomorrow straight away. It depends on the availability of the slot.
Okay, I think before we go to the next question, I just would like to say that Dr. Amirul talked a lot about the buffer system, but I would like to say that the buffer system is there to see people that are urgently ill, or the elderly, or people who could not come again, they live very far. But for people that when we were assessed, would seem to be stable, can come again tomorrow, then you may be given appointment the next day. And for that, just now the triage nurse can help to make the appointment for you. So so that the system is still intact and people can be seen at the correct time. So the next question I think is to do with if they don't have appointment, okay, and then they just come.
Yes.
So there'll be grouped into two groups, right, Amirul? If you're urgent, your case urgent as seen by the nurse and the doctor, then you will be given a slot to be seen that day. But if not, you'll be again asked to make an appointment for the next day or the day after. And once you put into the slot, you are deemed urgent, then we will try the best that we can to see you as soon as possible. Yeah. But if you don't have urgent medical concerns, then we will advise you to make an appointment for the next day. I think those that use our system, they're quite happy.
Yes, we received an email from someone from Seremban saying that she is thankful for this system because she are able to make appointment for the mother. The mother is living in PJ. However, the mother are unable to make appointment by themselves. So she created an email address for her mother and make appointment remotely from Seremban for her mother. So when the mother comes, she just screenshot the message, the notification, and send it to the mother's WhatsApp, and the mother just present to our counter and show that she has already had an appointment. And if you come to our Ruka clinic now, comparing to before the ABC, you can see it is much more calm compared to before. Before it's quite chaotic and it is not conducive, especially in the era of endemic that we have now.
So Young has a comment. I think we have to. Okay.
Currently, my mom is already seeing Ruka and has next appointment pre-scheduled upon registering her in the app. Will her appointment be reflected in the app? Okay, thank you. That is a very good and valid question. The appointment for ABC, appointment-based clinic, is only for walk-ins appointment. That means it's only for first-time comers only. Once you are already registered inside our system, our hospital system, you will be given appointment under the hospital system, where usually it will be written in your appointment card or appointment book. So that one is in a different system compared to our appointment-based clinic system.
So for the appointment-based clinic appointments in the app, you use that to come in to our clinic in the morning. So for the afternoon, if you have an appointment to see our doctor in the afternoon, you use your blue card, show it to our triage nurse to say that you have an appointment today, and you'll be allowed to come into the clinic. Thank you, Yung. Okay, any more questions? No? I have a few questions. Yeah.
Okay. If a patient misses his or her Ruka appointment, can they make appointment using the apps? Okay, if let's say the appointment that you miss is an appointment on the afternoon, which is your normal Ruka appointment, you cannot use the system because the system is intended for walk-ins only. So what you can do, you can contact us and reschedule your missed appointment.
Or if you cannot, I mean, if you have difficulty to get through to us through the phone, you can come on behalf of your mom and go to the counter, and the counter can make a new appointment for your mom. Okay. All right. So I have a few questions to Dr. Hoi Min actually. So Dr. Hoi Min, so you were mentioning that when you Google certain things all the time, let's say I always Google about papaya leaves, and after that, the information that comes to me just about traditional medicine and papaya leaves. Why does that happen, Dr. Hoi Min, and how can I get out of that?
Yeah, I think one of the reasons is because first is what is the keywords that you use in terms of when you search. So what is the keywords that you put into the search engine? So if you putting keywords where it goes to, for example, papaya leaves cure dengue, so more likely you would have all the papaya leaf that it really cure dengue. So second thing is I would say the websites kind of remember, the browser kind of remember what you searched previously. Examples such as your Facebook and social Instagram as well. So once you search certain things, so the back end will be able to remember what you search and really will push the information, which is almost similar as the previous information that you encountered. Then it will give you a false perceptions or idea that those are the information that are commonly available in that. But actually, the browser and the social media platform are quite smart in pushing the information that you are interested in. So this is what we call corroborating the information. So if you had encountered a misinformation and you keep encountering the same statement, it is more likely for you to believe that misinformation is actually true.
So there is such thing in the internet that called an algorithm, meaning you will be characterized as someone who likes traditional medicine. So they will be pushing more and more information about traditional medicine to you. Whereas if I go in and search papaya leaves, I might get the more negative type of information, because I usually like to see the scientific evidence in my internet search. So another way you can probably clean your history. But I think these algorithms sometimes go even beyond that. They even know what you look on the Facebook, they even know what you look on the Insta. So all of that, all interconnected. Another thing that I would like to mention as well, Hoi Min, is that nowadays when you use the search engine, the first few hits are actually ads. And it's stated on the top there, ads, ADS. So please be careful that they are actually paid content for you to get to you. So be careful with ads, and now they have to mention it is ads. So if you want to get a more credible one, you can look at the ads, but if you want to, like the Hoi Min said, be a skeptic, always look for second or third information to corroborate your first information. Miro, anything to add?
Just want to add regarding the algorithm. Actually, in social media, particularly, this algorithm will create what we call an echo chamber. For example, if let's say you are looking something about traditional products, it will group you together with people who are actually in the same interest, and perhaps it will be more detrimental if let's say they group you together with people who don't believe in modern medicine as well. So it will create an echo chamber where you have a lot of people on similar belief, and you start to believe that actually a lot of people saying this, but since it's only an echo chamber, you are not allowing yourself to see beyond the chamber, and it might cause misunderstanding as well.
Like the frog under the tempura.
Yes.
And then you're just listening to yourself. Yeah. Any more? All right.
One more question.
One more question. Okay.
Not there. Oh, okay. So this app is more ad hoc walk-ins and emergency situation. Oh, yes. Yes, it is for ad hoc walk-ins. If you have appointment or you have defaulted or you have missed your appointment, then this system, this ABC system is not suitable for you to remake that appointment. However, for emergency situation, please present yourself to the nearest emergency department, and please do not make appointment for emergency situation because we don't know whether there is a slot available. And if you have any emergency situation, you don't have to make any appointment to come to the nearest clinic or nearest hospital. I hope that answers all the questions.
Thank you. Thank you so much, everyone. Thank you so much, Dr.
Thank you so
Irene. Thank you, Amirul, for this. We hope to do something like this again. Please give your feedback, whether this is helpful, put it in your comment, so we can have another session to describe or elaborate more upon a certain situation. We would welcome your recommendations as well on the topic that we should cover. Thank you very much, everyone. Bye.